Hi, Dr. Martin Rutherford here again, talking about today the liver. So for those of you who are just turning in because you looked online and saw, then we're researching liver for some reason. This is a series that's being done relative to the title of it's Back to Basics, as far as functional medicine, back to basics. And back to basics means this is kind of the classic functional medicine overall protocols that that I think one should expect to experience if they go into a functional medicine practitioner's office, unless the practitioner lets you know that I'm not doing that type of functional medicine, so to speak, and so back to basics. Liver. And for those of you, again, who are just tuning in, I walk through this from the eyes of a daily practitioner and what they actually see in practice. So for example, on liver, I'm not going to be going through cirrhosis and all the herpes viruses and all that. We might touch on the virus a little bit because that's not what we see. We don't generally see people coming in here at end-phase, liver cirrhosis, and alcoholic, cirrhosis or hepatitis, or I rarely see those things. That person has already gone and to the medical field and gotten all the tests and then they come here, or they get fixed that way. So the liver is kind of interesting. In our world, the liver does, well, okay, just a little brief. Okay, liver's pretty wild. The liver, when I was in school, they said it did 250 things. 10 years ago, they said 350 things. And now the liver does 500 things. And it truly is an amazing organ. It is massively regenerative. So for all of you, we'll talk a little bit about fatty liver for all those of you out there that have fatty liver, which I see a lot. If you do the right things, you don't have to worry about it. I mean, it's got to be really, really gone for you to not get rid of that fatty liver. So the liver is just, it's 4 different lobes. They all do different things. It's a detoxification center. Everything that you dump into your body that doesn't belong there, that liver tries to neutralize or get rid of. There's several. There's like 7 different pathways in the liver that detoxify. There's sulfonization, glucuronization. Big one to me is the glutathione pathway, because I see a lot of autoimmune patients. Kind of hard to get autoimmunity if you have enough glutathione, which is probably a separate topic for another day. It stores a lot of our nutrients, particularly is important in blood sugar management. So it makes vitamin K. It stores a lot of other fat-soluble vitamins. It processes fat. It's cholesterol, triglycerides. It has to do with making proteins. Oh my God! It's just like it does 500 things. So you could go on for a long time processing B vitamins, but the big thing by the time a person gets here is usually it's not working right because of the lifestyle that the patient has had before they've gotten here, or maybe the patient's been working around toxins, or maybe we'll talk about some viruses, what a herpes virus might mean to somebody who has a chronic condition. But mostly for us, and another big thing that the liver does is it clears out all your hormones. And I mentioned that one because another big thing it does, and one that we see mostly here, is the liver not clearing out people's hormones correctly, particularly estrogen for the female. So the types of things we see is that we see females that come in relative to liver that maybe have polycystic ovarian syndrome. Maybe they're in menopause and they're having hot flashes. Maybe they're not. Maybe they're not having. Maybe women aren't having their periods. And a lot of them are surprised when I say, well, the first thing we're going to do is we're going to go and we're going to clear out your liver. We're going to clean out your gallbladder and your intestines, because you're probably not clearing your estrogens right. When you're not clearing your estrogens right, it sticks in the liver, it sticks in the gallbladder, and then you have a deficiency of estrogen. It's not getting cleared, and it's interesting. A deficiency of estrogen, as well as too much estrogen, expresses itself in the same way, because if you don't have enough estrogen, you have all the symptoms of not having enough estrogen, and you got depression, and you're fatigued, and you're putting on weight, and all those wonderful things. But if you have too much estrogen in your system, because you're not clearing it out and it's staying in your system, in your liver, in your gallbladder, in your fat cells, okay, adipose tissue cells, then it shuts down what's called the receptor sites for your estrogen molecules, and then the estrogen can't get in. So it's just like you don't have enough estrogen. Kind of an interesting thing for a lot of you. So the liver is kind of unique, and that's one of the things that we in the functional medicine world see as far as liver goes coming in. A lot of female problems that are poor clearance. We have a staff member here who hadn't had a menstrual cycle in, I think it was 2 or 2.5 years, and all we did was put her on a 6-week cleanse, and 2 weeks into the cleanse, she had her menstrual cycle back. So that's how that works. It is about clearing. In that particular case, it's not clearing out your estrogen, okay? Maybe it's, and a detoxification is something gets ingested that shouldn't be there. It goes to your liver. In your liver, there are the multiple pathways for clearing out toxins. I just mentioned 2 of them: sulfonization, glucurization, there's methylization, there's the glutathione pathways. There's 7 pathways. And they all do different things. And so they take these substances, and there's 2 major pathways. And one pathway breaks everything down and makes it water soluble so that it can run through your system. And then the second pass through, what will happen is there's a molecule attached to the broken down substance, and that molecule attaches to that substance and allows it to go through the second part of detoxification. And being attached to that molecule actually allows it to go through the proper detoxification process and end up in the toilet, either through urine or feces, or maybe clear out through sweat. If that pathway if that second pathway is broken down, and you just have that first pathway working, and the second pathway isn't able to attach that molecule to it, you become very sick. You are the person who cannot take medications. You are the person who cannot eat supplements. So because when these toxins only go through the first phase 1 to become water soluble, until something's attached to it, they are toxic. And so if certain aspects of your liver aren't working properly, then that is the person who comes in here and says, I'm not going to be able to take any of your supplements. I'm like, why are you here? I'm not going to, because I can't take any medications. And so, but I say, why are you here? Because we know what to do with that. So that's kind of like a general basics of the liver. I must say, we had a conversation right before he came in here about the liver backing up and gunking up and all the problems it can cause. But again, I don't get basically the cirrhosis patient in general. Occasionally I'll get somebody who's had cirrhosis for a long time. I don't get the hepatitis patient who's in acute hepatitis or anything like that. So the liver does back up, but for the people who come in here, but most of the time, the people I am seeing will go back to the back to basics gallbladder section that I did last week. The vast majority of the time here, it'll be the gallbladder that is not, that is heavily connected to your liver. To me, they're one and the same, although, or at least close brothers, sisters, or twins, because they heavily work together. The gallbladder dumps out all of the bile and all the toxins from the liver into the intestines. To me, what I'm seeing a lot is it's more the gallbladder that is the problem backing up the liver in my practice, in the people who show up here into a functional medicine practice. And then you start to get the symptoms of the poor clearance. So what are the symptoms? Acne and unhealthy skin. Well, that's kind of a given. When people come in here and they have skin problems, they've been to the doctor, they've had the ointments, and they've done shots, and they think it's an allergy, and they've rubbed all this type of stuff on. The skin is an extension of the inside of your intestines, and so you might first look to your intestines for that. But when the gallbladder and the liver, and you're going to hear me kind of talk about both of them together, are not clearing, then those toxins are going to be not getting into the intestines and into the toilet the way that they should. They have to go somewhere. And one of the most common places that they go is the skin. Now, you can have acne for other reasons, okay, but not many other reasons. You could have acne because you have polycystic ovarian syndrome. Okay, you could have acne because you just eat like crap all the time, but that's not the patient who usually shows up in here. And so when people come in here and they start, like I had one yesterday or 2 days ago, and I'm absolutely certain it's poor liver clearance, and she eats this stuff and she gets a rash over the bottom part of her legs. You're going to hear me say liver clearance a lot because those two liver pathways that I talked about, the phase 1 that breaks it into water soluble materials, and the phase 2 that attaches the molecule and does the rest of the work, that is called hepatobiliary biotransformation. That's a fancy word of saying it biotransforms that toxin into water soluble, attaches it, and transforms it into something that can go into the toilet so that you don't get sick. And so that's largely what's happening with so many of the skin conditions. Excessive hair loss. Why would you get excessive hair loss for liver, okay? The liver has a lot to do with clearing all of your hormones, and it has a lot to do with what we talked about in the first place. We talked about estrogen. Okay, so you have to clear out estrogen. If you're not clearing it out, you get symptoms of not enough estrogen. Even though you have too much estrogen, you have symptoms of not having enough estrogen, and that'll make your hair fall out. The liver is also heavily influenced by the thyroid. If you have hypothyroid, if you have Hashimoto's, the liver might slow down because the thyroid slows everything down when it's not working right. Now it's not detoxing. It could be a direct fact that's causing you to have not enough thyroid hormones cleared out of there. That can cause your hair to be falling out. If the liver's slowing down, again, it's not clearing the estrogen. That can be making your hair falling out. And people say, well, I get it when I'm stressed. If it's stressed, then that's a different mechanism than the liver. So there's a couple things that can cause your hair to fall out. Thyroid directly can cause your hair to fall out. Thyroid indirectly can cause your hair to fall out relative to getting stressed. But the liver is usually a good bellwether if your hair is falling out, that you need to look at that liver. Overall sense of bloating. An overall sense of bloating, mainly the liver, if it's being overworked, and so what makes the liver toxic? Okay, most of us know alcohol makes the liver toxic, but just toxins in general. If you're inhaling toxins like molds, if you have some viruses and they're low level and they haven't reached the point of like hepatitis or something, that can alter function. but it's basically, you're eating junk, you're eating a lot of foods, you're putting a tremendous, you're creating inflammation in your intestines. If you have small intestinal bacterial overgrowth, the bad bacteria have to be cleared somewhere. If you have inflammation in your intestines, it has to be cleared somewhere. If you have food sensitivities, they create inflammation. The inflammation has to be cleared somewhere. So, I mean, the liver has a lot of things that cause it to gunk up, other than the obvious junk food, fatty food, fried foods, which gunks it up by gunking up the gallbladder as well. So, I mean, it's just everything. Just think of anything that doesn't belong in your body, it has to go through that liver. If you walk into a perfume, like we have a Macy's here, and you have to walk in the front door, you have to walk by their cologne section. And if you walk by that cologne section and you're like, oh my God, I can't do this. Part of that's your liver for sure. Part of that is your liver. Those molecules are coming in to your system. They're ultimately going through that phase 1 and phase 2. And those people have a glutathione deficit, a big glutathione deficit, because glutathione is a pathway in the liver. It's supposed to grab that molecule and it's supposed to kill it. If you don't have enough glutathione, that's part of the reason that you have that type of a sensitivity. So those are the things that cause the liver. And going back to an overall sense of bloating. Bloating usually is going to come from, it can come from small intestinal bacterial overgrowth. Separate from that, it's going to come from poor gallbladder function, poor stomach function, or poor pancreas function. If you have, and all of that is wrapped in with the liver, because it goes back to me saying a lot of times the liver gets backed up because of the gallbladder. So if you have poor stomach digestion, you don't digest the hydrochloric acid, you don't have enough hydrochloric acid in your stomach, which is there to digest your proteins, then that's going to cause you gas and bloating immediately after a meal. But that's also going to tell your gallbladder to work, not to work, and then that chain is going to tell your pancreas not to work. Either one of those two, in and of themselves, can also cause gas and bloating, but the gallbladder will also back up the liver. Okay, so if we have so by that time, now you have a backup of a system that does 500 different things. So an overall sense of bloating can be liver. In fact, and one of the more pathological things, which I do see for some reason, is people coming in here with like swollen ankles, or swelling or edema in their feet or their lower legs, or sometimes even up in their higher legs. That can be a more serious liver problem. For some reason, I do see that occasionally. For some reason, that gets passed off, maybe because there's so many things that can cause swelling in the ankles. But that can be a liver issue, because when things back up in the liver, they back up. The whole system backs up. And so it backs up into your bloodstream, it backs up into your kidneys, it backs up, and then it's not going anywhere, the fluids aren't going anywhere, and the next thing you know, gravity brings those fluids down to your legs. Bodily swelling for no reason at all, that's basically the same thing that I just got done talking about with the backup. Hormonal imbalances, I think we've already talked about that a little bit. It's really more female hormone imbalances, and again, the liver is the main organ that detoxes your hormones. And a little review: hormones are supposed to be made, they're supposed to go to your cells and get used, they're supposed to go through the liver, the intestine, or the gallbladder and the intestines, and then they're supposed to find their way into the toilet. The unused estrogen, progesterone, testosterone is supposed to find its way into a toilet. It's not supposed to be sitting around in your fat cells or getting backed up into or just staying in the liver. So if that happens, then you're going to get symptoms of menopause, or you're going to get symptoms of not having a period, like our staff member. So when we see hormonal imbalances, is it the liver or is it the female organs, or is it detoxification or the female organs? So usually we'll go after the liver first for all of those of you who are sitting out there and have hot flashes and are having abnormal periods and heavy bleeding and not having and light bleeding, and just all of those things can be other things that are causing that are causing your ovaries to not work well. One of those other things is the liver. So for cases like that, if somebody comes in here with polycystic ovarian syndrome, or somebody comes in here with any of those types of female issues, we don't even begin to directly address the female issue until we've handled their liver, till we've handled their intestines, till we've handled blood sugar and essential fatty acids, which doesn't have anything particularly to do with this particular presentation. But those do have to do with hormonal imbalances. So liver is a big part of that, and detoxifying the liver to get all that excess estrogen out of there. If you're taking, oh my God, if you're taking like estrogen therapy, and I don't care whether it's oral or whether it's creams, and creams are like the worst, they cannot be dosed exactly correctly for your system, as you might imagine. Your system's a very delicate system, and usually there's too much. Usually the creams are absorbed into your fat cells, and they stay there. The capsules are over dosed, and so the body uses what it can, and then it gunks up the liver, the gallbladder, and a part of your intestines, and then you get all of these hormonal imbalance symptoms. You go to your female doctor and drive her or him nuts because they can't get you properly dosed, and that's the reason for that. Weight gain is when people come in here. Weight gain is a sign that maybe your liver is gunked up. You know, weight gain can be thyroid, it can be blood sugar, it can be adrenals, it can be gut problems, it can be viral infections. There's a number of things that cause weight gain. You'll notice I've already basically probably talked about all of them in some way, shape, or form. When liver detoxification has been popular for as long as they've been writing books about it. I read a book called the Tao, T-A-O, of health, sex, and physiology, and it's the American interpretation of the Chinese emperor's internal medicine guide, which was written 3,500 years ago. And so they talk a lot about detoxification in there, and the way they talk about it sounds like it had already been being done for maybe another 1,000 or 2 years. So it has not been lost upon the human race that detoxifying your liver is a good thing to do. And so because everything seems to pass through the liver can touch everything. Weight gain, we talked about thyroid. If you have a perfectly normal thyroid, if you have a hypothyroid, that slows everything down. It slows those detoxification pathways down. You're not converting thyroid hormones properly there into active hormones, which would allow you to keep the normal metabolism. Now your body metabolism slows down. You're putting on weight. You can't get rid of it. You don't know why. Blood sugar, the liver has a lot to do with blood sugar swings. So you could argue that your blood sugar swings, if I get low, I get irritable, I get shaky, if I don't eat, or if I eat too much and I fall asleep afterwards, that could actually be connected to your liver. Those are high and low, those are low and high blood sugar symptoms. But your liver breaks down most of your other nutrients, particularly your carbohydrates. It breaks it down into triglycerides, and then it's stored into the liver. It breaks it down into primary glucose molecules. Those are stored in the liver, and then when you need that blood sugar, when your blood sugar goes low, your pancreas and your adrenal glands work with your brain to tell your liver to give up a little bit of that stored sugar so that you can have sugar getting back into your body and into your brain. The main time I see this happening is in the middle of the night. Those of you who go to sleep, wake up, can't go back to sleep. That waking up and can't go back to sleep is because your blood sugar is dropped in the middle of the night. Your body knows your brain needs blood sugar, so it tells your adrenal glands to tell your pancreas and your liver to go get working. But specifically, it tells your liver to put a lot of blood sugar out so that you have enough blood sugar for your brain. And if you have enough blood sugar, you don't wake up. If you wake up, it's because that mechanism is waking you up to give you more blood sugar. Sometimes we'll just, same thing as the lady we talked about doing the cleanse and then having her period come back. A lot of times people can't sleep like that. We just detox their liver and all of a sudden they start sleeping. They don't know why. It's because that liver was being sluggish in that mechanism of delivering that blood sugar to them in the middle of the night. So that could be a liver symptom. Weight gain could be a liver symptom in so many ways. And all of them run through the liver. If you have a bad gallbladder and it's gunking up the liver and your hormones are off, that could be weight gain. So weight gain out of nowhere is usually thyroid, but if you have weight gain, it's always wise to go thyroid and liver, blood sugar and liver, gut and liver, and whatever, and virus and liver. So poor bowel function, I think poor bowel function, first when we have, this is another liver symptom, I think when we have poor bowel function, I don't think liver is the first thing we think of. I think we think of stress is the #1 cause of constipation. Hypothyroid is probably the #2 cause of constipation. And then when you get down into the actual gastrointestinal tract, where we've talked about all this on the previous segments, lack of hydrochloric acid in your stomach, if that's not breaking down your proteins, that's gonna cause poor bowel function. And poor bowel function can be constipation or diarrhea. Okay, so you can have bacteria causing poor bowel function. You can have gallbladder not putting its enzymes out, causing poor bowel function. You can cause pancreatic enzymes. That's one of the first go-tos that people seem to go to when they come in here. They're already taking pancreatic enzymes. But remember, if that whole chain of physiology breaks down, the hydrochloric acid in the stomach, that doesn't break down your protein, and then that sends a hormone to your gallbladder and says, okay, you need to stop working because I'm going to send this food down there that's not digested, and that's actually going to possibly cause you to have inflammation. So the gallbladder stops working. Both of those things tell the pancreas to stop working. Then you're definitely going to, that's a potential to have poor bowel function. And all of that will do what? All that will back up your liver. So basically, when you do a liver cleanse, you clear all of that out. You clear the sludge out of the gallbladder, you clear the liver, you get all those pathways working. Now the one thing that really lights me up, that the liver is a significant factor in what's going on with that person, is if the person has excessively foul smelling sweat. Okay, so maybe it's you, maybe it's people who are just like, they got this bad body odor, and you get around that person and you go like, ooh, man, what is that? Or and the person maybe has had to alter her lifestyle for that. I'm telling you, that is a liver that has not yet reached a stage of pathology. In other words, liver cirrhosis or things of that nature. That liver can be helped, but it takes a lot more than just a basic liver detox. At that point, you really got to get in there and hit each one of the pathways with different herbs, botanicals, supplements, whatever that person particularly uses, homeopathic remedies. You have to get in there, and that liver at that point, most of the time the liver here is part of the problem. Okay, is kind of part of what I'm trying to say here. You can see it's connected to all of these different things. It has so many tentacles as to how it can affect everything, which is why the liver cleanses have been popular, justifiably so, for thousands of years. But when it gets to this point, the liver is really, really the key, and so you have to go after it aggressively. And now the liver, instead of being part of the whole protocol, the liver becomes the issue. And at that point, but to fix the liver, you gotta be pristinely clean. You have to make sure that the person is eating properly, they have no food sensitivities. This is where it really gets into like, this is a liver problem, but all this other stuff's got to go. They have to be digesting well so that it doesn't back up the bile duct, because if you just do the liver cleanse and if you just do the liver bile gallbladder cleanse, it's going to work for about a week, or it's going to work for maybe 2 or 3 weeks. Maybe the person's foul-smelling sweat is going to go from severe to moderate, but it's not going away. So you have a serious clearance problem when you have that foul-smelling sweat. But to step back, if you have really foul-smelling sweat, that's where it's at. And that's my gauge in a case like that. If I have somebody who's in here and everything's doing better, but they still have that foul-smelling sweat, I know that everything that I did is going to be for naught within a couple of weeks or a month or two, that it's all going to be coming back, because that liver and that gallbladder are not clearing. And as you can see, it's connected to everything. I mean, I could go on for hours with all the things it's connected to. If I went to one course that was called Mastering Blood Chemistry, and they had sections on, the gallbladder, and sections on the stomach, and the sections on all these things were, like this. The section on the liver was like this, So fortunately, the liver is pretty, as far as functional medicine goes, by the time people get here, pretty much what I just got done telling you is like the scope and breadth of the liver. And how do you know you have it? A lot of times you'll go to the doctor and they'll run enzymes. I almost forgot this. They'll run enzymes, or not enzymes. They'll run enzymes on you, and those enzymes are in most metabolic panels. And they'll say, oh, your SGOT is fine, and it's so you don't have any liver problems. Meanwhile, you have every single one of these symptoms. Okay, so understand, first of all, it takes a long time for those symptoms to create enough damage for it to show up on the test. And for those of you who've watched all of these videos, you'll see a pattern here. What we're trying to do in functional medicine is get function normal again before it becomes pathology, before it becomes cirrhosis of the liver. So and what usually happens first is you usually get a fatty liver. So most people know the fatty liver comes from alcohol abuse. Most of the patients here, it comes from blood sugar problems. And it doesn't have to be diabetes. It can be that you have what's called insulin resistance. You're just on the first steps towards diabetes. It could be pre-diabetes, and of course that comes from, maybe it comes from alcohol, but it usually comes from eating a lot of junk, a lot of sugars, a lot of processed foods and processed carbs and all that type of stuff, the standard American diet. And eventually what happens is all that's being turned into fat, and you get what's called a fatty liver. If that fatty liver is not too bad in the eyes of the doctor, because those transaminases, those enzymes that I talked about, are not over 200, then and the range for transaminases should be like 10 to 25. If they're and the doctors don't usually get too lit up on you until it's over 200. And if it's 35, you're developing a fatty liver. And that needs to go. Again, that also takes a little bit more effort to get that fatty liver under control, because you actually have to fix the problem that is causing the fatty liver in addition to the fatty. So you're gonna have to change your diet. If you're drinking too much, you're gonna have to stop drinking too much. If there's a kind of a flow of understanding in our intake forms as to what the types of things might be that are causing that to gunk up. But fatty liver is not a death sentence. It will frequently, if you understand what's going on, it'll frequently go away. The doctors usually won't handle it until your transaminases are over 200. Once they're over 200, you now do kind of have a problem. I don't see a lot of those here. I've seen a handful, and even they have done okay. Okay, but at that point, that's where you start getting into serious liver problems, and maybe it starts getting tender, and maybe it's swollen because it's backing up, and those types of things. So from a perspective of, so So having said all of that, in the functional medicine world, it is largely about what's called hepatobiliary biotransformation. Which is a fancy way of saying it's about detoxing that liver. It's about clearing that liver out. Unless you get into the high fatty acids, or I'm sorry, the high fatty liver numbers, or unless you have that foul smelling sweat. Most of the time, a good 2, 3, 4, 5, 6 week detox is kind of a good layer. What am I saying? Kind of a good entry protocol for almost everybody out there who is suffering from almost anything and hasn't had any success. The liver detox, there's gentle liver detoxes, there's aggressive liver detoxes. The sicker you are, the gentler you should go. I know it may seem counterintuitive, but usually you're going to do a liver detox, a liver cleanse. Yeah, everybody's got their products. We have our line of products that we prefer. And I usually warn people, when you do liver cleanse, you're probably not going to feel too good. If you do a fast, you're not going to feel too good, because you're just going to overload that liver with all kinds of toxins, because now your body is allowing that to happen. But even if you do a liver cleanse, you could feel not good for the first, most people, 3 to 5 days. I've had people who haven't felt good for the first 10 days to 2 weeks. If you're doing a liver cleanse and you're not feeling good for more than 10 days, then it might be that there's something else going on. So that's the general. Again, I'm not here to go into the whole issue of the liver. I'm here to kind of focus you in on the types of things that you would encounter yourself, and that the functional medicine practitioner should encounter, and how it should fit into that functional medicine model. So for me, we did a big talk last week on gallbladder, and to me, it's interesting, but here it's almost more gallbladder backing up the liver than it is the liver being a bad problem. But frankly, if we treat one, we treat the other one, because they're together. So that's liver and liver gallbladder again. And so next week we're going to be talking about the adrenals. And that'll be kind of fun, because everybody that comes in here knows about the adrenals. Forever it's been about the adrenals. They're the stress hormones. The adrenals are pretty cool, but they're actually more your homeostatic glands. And we're going to talk a lot about that, and how sometimes there used to be a term, if you can't fix the adrenals, you can't fix a person. To a degree, that's true. But we're going to talk about why, if you don't fix the person, you can't fix the adrenals next week as well. So or my next segment as well. So I would, so for the adrenal fans, I would tune into that. You might hear some different stuff going on there that I think you'll find very beneficial. So until then, Dr. Rutherford with another exciting episode of Functional Medicine Back to Basics, signing off until next time. Bye.